Tina is informed that her dad just suffered a stroke and has been admitted to a big hospital in town by one of her relatives. Not being fully aware of what a stroke is, she rushes to the hospital to see her dad. On reaching the hospital, she is shocked to see him in the ICU, with all nursing staff around monitoring his vitals. She meets the doctor who is in charge of her dad's treatment, who gives her the confidence that Mr. Verma is out of danger and requests her to understand the disease better.
Doctor, is my dad out of danger? What actually happened to him? Can you kindly elaborate his condition?
We are all aware of the term heart attack, in which the blood supply to some part of the heart is compromised, leading to pain. Similar to a heart attack, stroke is a brain attack. In stroke, some part of the brain does not get enough blood supply. When this happens, brain cells are deprived of oxygen and nutrients, and the brain cells begin to die. Sudden bleeding in the brain can also cause a stroke if it damages the brain cells.
Can a patient get immediate treatment in the house when he gets stroke?
No. Stroke is a medical emergency. The patient should be admitted to the hospital at the earliest. The concept of time is brain is being discussed at all medical forums. It has been quantified that a typical stroke patient loses 1.9 million nerves each minute in which a stroke is untreated. Prompt treatment can minimize the damage to the brain and helps in faster recovery.
But doctor, why my dad? As far as I remember, he has been very sincere in maintaining his health after retirement. He goes for regular walks, has timely meals, and follows a disciplined lifestyle as he has been diagnosed of high blood pressure in his early 40s.
Stroke is very common across the globe. However, latest scientific evidence suggests that rates of stroke in India are higher relative to Western industrialized nations. Based on recent Indian study, it is estimated that around 1.6 million Indians suffer from stroke. Almost 75% of patients survive a first stroke. But of these individuals, 25% are left with a minor disability and 40% experience moderate to severe disabilities. Also, stroke patients are at high risk for recurrent stroke, putting them at a greater risk of further disability. Hence, there's an urgent need to improve our understanding of various action plans needed to enhance post-stroke recovery. Tina, your dad has been lucky enough to get prompt medical treatment, so we can expect least disability and a faster recovery from the stroke. There would be many unidentified risk factors and certain symptoms which Mr. Verma must have ignored. The risk factors of stroke are classified into non-modifiable and modifiable factors. Age is the single most important risk factor for stroke. For each successive 10 years after the age of 55, the stroke rate more than doubles in both men and women. An increased incidence of stroke in families has long been noted. Potential reasons are a genetic tendency for stroke and a genetic determination of other stroke risk factors and lifestyle risks. Gender also is a non-modifiable factor for stroke. It is well documented that the incidence of stroke is higher in men than in women. The prevalence of stroke is higher among men up to the age of approximately 80 years, after which it becomes higher in women. There is a huge burden of stroke with significant geographical variations. Incidence of stroke in India is higher in the rural population than in the urban population. High blood pressure, also called hypertension, is the most common and important risk factor for stroke, with almost 80% of stroke patients suffering from hypertension. Other important risk factors include high cholesterol, diabetes, and tobacco smoking. Cigarette smoking doubles the risk of stroke. Various lifestyle factors have been associated with increased stroke risk. These include obesity, physical inactivity, unhealthy diet, and acute triggers such as emotional stress. Obesity has been associated with higher levels of blood pressure, blood glucose, and high cholesterol, which are independent risk factors for stroke. These medical factors are modifiable risk factors which can be controlled with appropriate medications. Based on the cause of stroke, it has been classified into different types. 80% of the stroke victims suffer from ischemic stroke. The word ischemia means an inadequate blood supply to an organ or part of the body. In ischemic stroke, a blood clot blocks blood flow to a part of the brain. The clot may form in a blood vessel within the brain, or it may form elsewhere in the body and travel to the brain. About 10% of strokes occur when a blood vessel in the brain bursts. This causes bleeding in the brain and also cuts off blood flow to a part of the brain. These are called hemorrhagic strokes.
Doctor, what are the warning signs of stroke? Did my dad and me miss to notice those signs?
It's possible. Mr. Verma must have definitely experienced the symptoms of stroke, which went unnoticed until he landed up with actual stroke. The most common symptoms are sudden weakness or numbness of the face, arm, or leg, usually confined to one side of the body. Sudden dizziness, loss of balance or coordination, especially when combined with other symptoms. Other symptoms include blurring or decreased vision in one or both eyes, and sudden severe headache with no known cause. A major warning signal of stroke is called TIA, which is transient ischemic attack. The word transient means something which is not permanent. When blood flow to a part of the brain stops for a short period of time, it is called a transient ischemic attack. It can mimic stroke-like symptoms. TIA symptoms appear and last from 2 to 15 minutes, and occasionally lasting as long as a day. TIAs generally do not cause permanent brain damage, but they are a serious warning sign that a stroke may happen in the future and should not be ignored. TIA is a medical emergency. Approximately 1 in 10 patients with TIA experiences a stroke in the next 3 months. 50% of strokes occurring within the next 30 days occur within the first 24 hours after TIA. Early initiation of preventive treatment for TIA reduces the risk of stroke by approximately 80%.
Doctor, do all patients undergo a standardized treatment plan for the management of stroke?
The management of stroke depends on the type of stroke, but is always an emergency. Acute management involves medicines or surgery in some patients, followed by chronic therapy with medicines and a rehabilitation program for all patients. Doctors play a vital role in the acute management of stroke with the goal of stabilizing the patient at the earliest. They control all vital parameters like heart function, blood pressure, blood sugar levels, body temperature, oxygen levels in blood, etc. Tina, you will play a central role in Mr. Verma's rehabilitation program once he is discharged from the hospital.
Yes, doctor, why not? Can you please highlight the key features of the rehabilitation program?
Rehabilitation is primarily based on the patient's disability. The primary goals of rehabilitation are to prevent complications, minimize impairments, and maximize function. Stroke rehabilitation begins in the hospital as soon as the life-threatening problems are under control with medicines. While every stroke is different, some type of disability or physical limitation is common. Setting reasonable step-by-step goals is important for recovering mobility and enhancing as much independence as possible. Patients must learn to live life as comfortably as possible after stroke. Stroke may have some impact on physical activity coupled with emotional and behavioral changes. Some people may face communication challenges, but most stroke survivors can improve their ability to communicate with ongoing effort and treatment. The good news is, most disabilities resulting from stroke improve with time, including the emotional health. Regular checkup appointments with your doctor healthy eating habits, and other strategies can help get existing medical conditions under control.
Doctor, does that mean that my dad cannot manage his daily activities by himself? He loves his independence and will be devastated if he has to depend on support system lifelong.
No, Tina. Mr. Verma will soon start enjoying his independence if we put him on the rehabilitation program at the earliest. During the rehabilitation program, on his journey to recovery, the patient and his family members play an important role. I am your doctor who will monitor Mr. Verma's medications from time to time. Since he is a hypertensive for many years, controlling his blood pressure is of utmost importance to prevent a second stroke. Mr. Verma has to undergo an exercise regimen to strengthen muscles for walking, standing, and other activities. Tina, your dad has minimal nerve damage, but still, for the next few days, he will need your help to manage his daily activities. Maintaining a regular diet is very important for his recovery. Choosing healthy foods can help achieve good energy levels for therapy, exercise, and his favorite activities. You have to understand him well and help him cope with the emotional challenges during his recovery from stroke.
Doctor, are there any specific physical exercises recommended for stroke survivors?
Yes. All patients should be advised to exercise regularly for as long as they are able to do them. The aim should be to achieve moderate physical activity for 20 to 30 minutes each day. Exercise programs should be tailored to each patient, following appropriate assessment. You need to encourage the patient to perform the suggested exercises. But a word of caution is to not overdo any exercise. The standard exercises suggested by physiotherapists are to enhance shoulder motion and possibly prevent shoulder pain. Lie on your back on a firm bed. Interlace your fingers with your hands resting on your stomach. Slowly raise your arms to shoulder level, keeping your elbows straight. Return your hands to resting position on your stomach. To maintain shoulder motion, lie on your back on a firm bed. Interlace your fingers with your hands resting on your stomach. Slowly raise your hands directly over your chest, straightening your elbows. Slowly move your hands to one side and then the other. When all repetitions have been completed, bend your elbows and return your hands to resting position on your stomach. To promote motion in the hip and knee, lie on your back on a firm bed. Keep your interlaced fingers resting on your stomach. Bend your knees and put your feet flat on the bed. Holding your knees tightly together, slowly move them as far to the right as possible. Return to center. Slowly move your knees as far as possible to the left, still keeping them together. Return to center. To improve motion at the hip and knee, simulating the movements needed for walking, lie on your unaffected side with your legs together. Bend and move your affected knee as far as possible toward your chest. You may need your helper's assistance to support the leg you're exercising. Return to starting position. To strengthen the muscles that straighten the elbow. Sitting on a firm mattress or sofa, put your affected forearm flat on the surface with your palm facing down if possible. You may want to place a firm pillow under your elbow. Slowly lean your weight onto your bent elbow. You may need your helper's assistance to maintain your balance. Push your hand down against the support surface, straightening your elbow and sitting more upright. Assistance may be required to prevent sudden elbow collapse. Slowly allow your elbow to bend, returning your forearm to the support surface. Work back and forth between the two extremes, completely bent or completely straight. in a slow, rhythmical manner to reduce stiffness in the trunk and promote the body rotation needed for walking. Sit on a firm, straight chair with both feet flat on the floor. If necessary, a firm mattress, sofa, or wheelchair may be used. Interlace your fingers. Bend forward and reach with your hands toward the outside of your right foot, rotating your trunk. Move your hands upward in a diagonal direction toward your left shoulder, keeping your elbows as straight as possible. Repeat the motions, moving your hands from your left foot to your right shoulder. Movements needed to rise from a sitting position. Sit on a firm chair that has been placed against the wall to prevent slipping. Interlace your fingers. Reach forward with your hands. With your feet slightly apart and your hips at the edge of the seat, lean forward, lifting your hips up slightly from the seat. Slowly return to sitting. To maintain the ankle motion needed for walking, stand at arm's length from the wall, knees straight, feet planted slightly apart and flat on the floor with equal weight on both feet. With your unaffected hand, hold your affected hand in place against the wall at chest level. Slowly bend your elbows, leaning into the wall. This places a stretch on the back of your lower legs. Keep your heels on the floor. Straighten your elbows, pushing your body away from the wall.
Doctor, I assure you that I'll take utmost care in providing the best care to my dad, as my goal is to get him back to near normal at the earliest. But doctor, how do I ensure that he does not suffer from second stroke ever again?
The best way to prevent a recurrent stroke is to modify the risk factors. Fortunately, Mr. Verma is a non-smoker. Else, it is very important to quit smoking to cut your risk of having a stroke. You need to take care of his blood pressure. Make sure his blood pressure is checked regularly. It is extremely important for Mr. Verma to maintain his blood pressure within normal limits. Also, we need to keep his cholesterol levels under control. It is mandatory for stroke prevention, as excess cholesterol builds in the blood vessel, compromising the blood flow to the brain. Once he regains his posture and walking skills completely, it is advised that he follows an exercise regimen regularly. We also need to closely monitor his blood sugar levels. Maintaining them at near normal levels is important for stroke prevention. Also, Mr. Verma should not drink more than the recommended limits of alcohol.
Thank you, doctor, for enlightening me on various aspects of stroke and its prevention. The fear which engulfed me as I entered the hospital has gradually waned off, and I'm not just hopeful but very confident of helping my dad on this journey of recovery from stroke.
She then joins her dad in the hospital room, giving him an assurance that everything will be normal gradually.